Like it or not, we're getting fatter. In the past 2 decades, the number of overweight and obese Australians has doubled. In America, 31% of adults, 61 million people, are considered obese. For many people with serious weight problems, dieting isn't the answer. Stomach stapling can be a last resort, but it's invasive and not without risk. But here at one of Rome's oldest hospitals, an ingenious procedure is being used to reduce the size of a patient's stomach without surgery in less than 20 minutes. At the Policlinico Umberto Primo, Gianna Zampetti is about to undergo what's known as an intragastric balloon procedure. Put simply, a balloon is inserted into the stomach so you feel full, eating less. Professor Nicola Basso has performed the procedure on over 1,000 patients. He even underwent the procedure himself. Did you lose weight?
I did. I lost, I think, 8 or 9 kilograms. The sensation of losing weight without having mind-blowing rules is very, very nice, yeah. You feel potent, you feel in command of yourself.
Here's how the intragastric balloon works. It might not look like a balloon, but there is one in there. Whilst the patient is under heavy sedation, the balloon is inserted into the mouth, manoeuvred down the esophagus into the stomach. Once in place, it's filled with saline solution via this tube. The tube is then removed and there's a self-sealing valve here that then closes. Now here's one I prepared earlier. There's about 500 mils of saline solution in there, just under a pint. Weighs about ½ kilo, and that floats around the stomach for the next 6 months. Apart from making the patient feel full, the main function of the balloon is to slow down the emptying of the stomach by up to 400%, so you feel fuller for longer.
From a normal time of 30-45 minutes of emptying time of the stomach, it goes to 4 hours, so it's a very striking difference.
Gianna wants to lose 50 kilos and is hoping today's procedure will be the start of a whole new life.
It should encourage me to improve my lifestyle, engage in sports activities more. I used to go horse riding, play tennis and ski. Skiing's my favourite sport. Let's hope I'll be able to go back to it.
Gianna has been sedated and is unconscious. The professor is now using an endoscopic camera to go down the esophagus into the stomach and see that the placement of the balloon, where it's going to go, is okay. After checking the stomach, Professor Basso and his colleague Dr. Alfredo Genco insert the balloon into Gianna's throat.
It's coming down. Okay. Now we are in the stomach.
Okay. The balloon's in exactly the right spot in the stomach, and now you can see it's starting to fill up. Look at that. It's estimated 1.5 million people in Italy alone could benefit from surgical intervention for obesity.
We will stop when we see a perfect sphere.
And the number of these procedures has doubled in Italy in the last 3 years.
See, now the balloon is inflated. Yeah. And we put some methylene blue inside.
This blue dye is used to colour the saline solution in the balloon, so a leak can be easily detected.
Now we disconnect the balloon from the feeding tubing by just pulling it out. And now the balloon is free into the gastric cavity. Once we go down, you see here?
Yeah, look at that.
And the procedure is now finished.
That only took 12 to 15 minutes, and Gianna's coming out of that sedation. That 12 or 15 minutes could have a life-changing effect on her. It certainly had a dramatic effect on 45-year-old Angelo Cimino. Since these photos were taken, he has lost 30 kilos. He needed to lose the weight for life-saving surgery.
I had the balloon inserted beforehand because I'm due to undergo highly risky surgery. I had poor blood circulation, not enough oxygen in my blood, so I had to shed a few kilos to get ready for the final operation, which is to take place within a month.
Now, Angelo couldn't be happier.
As regards the result achieved, I'm much more than happy. Happy doesn't really describe it. Losing 30 kilos is something you have to experience to really know what it feels like.
Allora, a posto.
Today, his balloon will come out the same way it went in. Now, the removal of the balloon is just as simple and just as quick as the placement. First, the balloon has to be emptied of the saline solution. So what they've done is they've just put a needle down the inside of the endoscope, and that's going to pierce the balloon, and once that's pierced, the balloon will be removed. The saline is sucked out through a tube.
We are removing the liquid.
All the liquid's just about removed, and when that's done, they'll take the balloon out. The balloon itself is taken out using this grasper tool.
And we grasp the balloon with 2 hooks.
That's 6 months old.
Yeah,
Yes.
6 months.
Incredibly good condition, isn't it?
Yes.
And that took about the same time as it did to go in. So a very, very short procedure and a great result. The rest is now up to Angelo.
1/3 of the patients lose weight and maintain this result. 1/3 will lose weight, roughly 15 kilograms, and gain back some of the weight, but not all. 1/3 will just regain all what they've lost.
The procedure costs around $6,000 and is yet to be approved outside Europe, and it must be noted there have been some complications. Remember, treatments like this are a last resort, and still the most effective way to lose weight is through diet and exercise.